and welcome to my channel. In today's video, I'm going to talk about homeopathic medicines for dengue fever. So in this video, basically today I'm going to talk about the homeopathic medicines which can be used for the treatment of dengue. So if you are suffering from dengue fever, then this video is definitely for you. So watch this video till end for more knowledge and stay connected. So let's start. So first of all, I would like to explain what exactly is the meaning of dengue fever. So dengue fever is a mosquito-borne illness that occurs in tropical and subtropical areas of the world. Mild dengue fever causes a high fever and flu-like symptoms. The severe form of dengue fever is also called as dengue hemorrhagic fever, and it can cause serious bleeding and a sudden drop of blood pressure that is called shock and finally leads to death. Now we'll talk about the clinical features, that is what are the symptoms of dengue fever. So, if you develop dengue fever, so symptoms usually begins about after the initial infection, and in many cases symptoms will be mild. They may be mistaken for symptoms of the flu or another infection. Young children and people who have never experienced infection may have a milder illness than older children and adults. And common symptoms generally last for 2 to 7 days. And these symptoms include sudden high fever that is about up to 106 degree Fahrenheit, or you can say 41 degrees Celsius. Next symptom you can face is severe headache. Then next symptom is swollen lymph nodes, severe pain in the joints and muscle pains. There will be skin rashes appearing between 2 and 5 days after the initial fever. Now we'll talk about the symptoms of the severe dengue, which can include belly pain and tenderness over the stomach or in your abdominal area, mild to severe vomiting, that is 3 times in 24 hours. Next severe symptom can be mild bleeding from the nose or the gums, vomiting of the blood or blood in the stool. Patient can feel fatigue, restlessness, or they can feel irritability. So these are the symptoms of dengue fever. Now we'll talk about the investigations. So what are the diagnostic criteria? So what are the various tests that can be performed in order to diagnose dengue fever? So let's talk about it. So doctor use blood test to check for antibodies, the dengue virus or the presence of the infection. A doctor may use a virological test or serological test. So first, and let's talk about this test. So dengue RNA PCR test, that is polymerase chain reaction test, it can detect dengue virus in the early stage of the infection and also help to detect the particular strain of the dengue virus causing infection. Now, the second test is viral antigen detection test, that is NS1. It is named dengue NS1 antigen test also. So, NS1 means non structural protein 1, and it can days and should be done within the first 5 days of appearance of the symptoms. Now, the third test for dengue fever detection is dengue serology, that is serological test. So, dengue virus specific antibodies IgG and IgM test. And among these two antibodies, IgG and IgM antibodies appear in the early stage of the infection and their detection while symptoms have already appeared indicate dengue infection. The presence of the IgM antibodies cannot be detected 1 to 3 months after infection. And if we talk about the IgG antibodies, detect infection in later stages of the dengue fever. As IgG level increases slowly, it can be detected till over 16-year age or even through a lifetime indicating past infection. Now the fourth test for the dengue fever is platelet count, that is CBC. So this is lowered in dengue hemorrhagic fever, and the normal platelet count is 1.5 lakh to 4.5 lakh per microliter of the blood. Low, low platelet count is medically termed thrombocytopenia, and in dengue cases, platelet count may drop as low as 20,000 to 40,000 per microliter of the blood. So these are the various tests that one can perform in order to diagnose dengue fever. All right. Now we'll talk about the treatment for dengue fever. So basically we are talking about the homeopathic medicines which can be used for the treatment for the prevention of dengue fever. So let's talk about the homeopathic treatment now. So first and the foremost medicine that you can see here on the screen is Eupatorium perfum medicine for the dengue fever, and it is undoubtedly the first medicine to be used in dengue fever cases. The characteristic feature to use it is severe muscle pain, bone and joint pains with high fever. This medicine is also popularly known as bone set as it brings about the quickest relief in severe bone and joint pains and fever. The pain can be present in any bone and it may generally be felt in the whole body. In general body aches, it feels as if the whole body is broken. Apart from relieving joint pain, it is also very beneficial if there is severe pain in the eyeballs caused by dengue fever. It helps in recovering from headaches with nausea and vomiting too. The headache is present mostly on the top, that is on the vortex of the head, and mainly the patient requiring this medicine, that is eupatorium for dengue, have severe chill with shivering and severe body pains. And after the chill is over, vomiting occurs. And majority of the cases, sweat brings relief in all the symptoms, with the exception of pain in the head. There will be weakness, tiredness may attend. So Eupatorium perfolium can be used as a preventive homeopathic medicine for dengue fever. And it can be used in 30 potency twice daily during an outbreak of the dengue fever. Or you can consult a qualified homeopathic physician before taking it. Now, the second homeopathic medicine for the dengue fever is Brainia alba. So, to manage the fever and the muscle in the joint pain, Brainia is a very important homeopathic medicine. This medicine offers the best help where there is worsening of the pain by any movement, even in the least degree. Complete rest gives relief from pain. There is fever with marked chill, and with chills, there is a heat in the head. There is extreme thirst for the water with a dry mouth, may be felt along with this specific feature. Now, third medicine for the dengue fever is Dustox. So, Dustox is another highly recommended medicine to relieve pain in the body during fever. It works best when muscle, bone, or the joint pain get worse from rest and are better from movement. There is fever with alternating heat and chill stays. There occur burning heat in body followed by chills and shivering. Now the fourth medicine for the dengue fever is gelsemium. So gelsemium is the best for dengue fever patients who experience utmost weakness and prostration, means emaciation, which is a state of dullness, dizziness, and drowsiness. D3 is a perfect description to select this homeopathic medicine, that is gelsemium. The patient needing it seem lethargic and have a desire to lie down in perfect silence without any disturbance. He or she also want to be quiet and dislike conversation. The patient experiencing the patient experiences shaking chills, which is most typically marked in the back and travel up and down the back. Another feature is headache with heaviness of the eyes. The headache is mainly present in the back of the head, that is in the occiput region, and that is in most cases travel up to the forehead and the eyes. Muscle pain may attend with all these symptoms which I have already said. Okay. Now our fifth medicine for dengue fever is belladonna. So this homeopathic medicine is used to manage headache, pain behind eyes, and fever with marked heat. In cases needing it, though pain may be felt in any part of the head but is mostly marked on the side of the head, that is in the temple region. So for using belladonna, the pain is very violent and throwing in nature. There is a tight binding sensation of the head which provide relief, and it is also helpful in relieving pain behind the eyes. And during fever there is an intense heat in the body with red flushed face and lack of thirst. Now, our sixth homeopathic medicine for dengue fever is arsenic album. Arsenic album is an ideal homeopathic medicine to manage weakness during fever. Even standing and walking result in fatigue, where this medicine is required. There is a need to lie down all the time because of the tiredness. There may be internal chills in the body, but the body is hot to touch from outside. Fever mostly comes at night and is attended with a marked anxiety and restlessness. There is thirst for little quantity of water at very small intervals. Arsenic can be given for managing nausea and vomiting. Nausea get worse by the smell or the sight of the food, and vomiting get worse from eating and drinking anything. Now, our seventh homeopathic medicine for the dengue fever is ipecac. So, for relieving nausea and vomiting, ipecac can be used as a first medicine. It is of great help when there is a persistent nausea and vomiting during dengue fever. Nausea does not get better even after vomiting. There is a vomiting of watery fluid along with cutting pain in the abdomen. Now, our eighth homeopathic medicine for the dengue fever, last but not the least, hemomelis. So, hemomelis is a brilliant medicine to manage bleeding from any part of the body. It is indicated to manage bleeding under skin from nose, gums, rectum, in urine, in vomitus. There is excessive exhaustion. So, these are the homeopathic medicines which can be used for the treatment and prevention of the dengue fever. Now, we will talk about how to prevent dengue fever. So, what are some precautions, or basically, I'm talking about the management part. So, what you can do to prevent dengue fever. Okay, so let's talk about the management. The best method of protection is to avoid mosquito bites and to reduce the mosquito problem population. So, when in a high risk area, you can do these measures. So, first is avoid heavily populated residential areas. Next, what you can do, use mosquito repellents indoor and outdoors. Next, wear long sleeve shirts and pants tucked into socks. The next, what you can do, use air conditioning instead of opening windows. Next, what you can do, ensure that windows and door screens are secure and that any holes are repaired. You can use mosquito nets if sleeping areas are not screened. And reducing the mosquito population involves getting rid of the mosquito breeding areas. These areas include any place where still water can collect, such as in wet baths, pet dishes, empty planters, flower pots, cans, and empty vessels. Okay, so these are some preventions that you can opt if you are suffering from dengue fever, or there is a high chances of dengue fever in your localities or in your areas. So that's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below. And yes, press the bell icon for more updates. Stay safe and stay healthy. And if you are suffering from dengue fever or any other health issues, then you can contact us. On the screen, you can see how you can contact us for online appointments or online consultations. So that's it for now, and thanks for watching this video.